Welcome to Pharmacology case studies. We'll start with antidepressant case studies. A 55-year-old teacher was diagnosed with depression. After 6 weeks therapy with fluoxetine, his symptoms improved, but he complains of sexual dysfunction. Now, which of the drugs might be useful for management of depression in this patient who is complaining of sexual dysfunction? Now, among this, sertraline, citalopram, mirtazapine, lithium. Mirtazapine is the drug which is free from sexual dysfunction. And sertraline and citalopram, these two are SSRIs which have sexual dysfunction as an adverse effect. Lithium is only used for mania and bipolar disorder. So here mirtazapine is largely free from sexual side effects. A 25-year-old woman has a long history of depressive symptoms accompanied by body ache, pain secondary to a car accident. Which of the following might be useful in this patient? Now the patient has to relieve his pain. Fluoxetine, sertraline, phenelzine and duloxetine. Now duloxetine is an SNRI and only SNRI treats pain accompanied by depression. Now SSRIs, these fluoxetine and sertraline are SSRIs and phenelzine is MAO, so these does not have any pain relieving effect. A 51-year-old woman with symptoms of major depression also has angle closure glaucoma, which antidepressant should be avoided. Contraindicated: amitriptyline, bupropion, mirtazapine, fluvoxamine. Now amitriptyline. Amitriptyline is a potent anti-muscarinic drug, and it should, because it increases intraocular pressure, so it should be contraindicated. And these all do not have any muscarinic effect. A 36-year-old man presents with symptoms of compulsive behavior. He realizes that his behavior is interfering with his ability to accomplish his daily tasks, but cannot seem to stop himself. Which drug would be most helpful? Desipramine, paroxetine, amitriptyline, sildenafil. Now be paroxetine. As you know, SSRIs are particularly effective in treating obsessive compulsive disorder, and paroxetine is approved for this condition. The other drugs are less effective obsessive compulsive disorder. Which antidepressant has as its two proposed principal mechanism of action 5-HT1 receptor partial agonism and 5-HT reuptake inhibition? It is partial agonism and also antagonist, reuptake blocker. Fluoxetine, aripiprazole, meprotylene, vilazodone. Vilazodone is it inhibits the serotonin reuptake, and the antidepressant activity of vilazodone may be related to receptor agonism. Aripiprazole is also approved for partial agonism, but it does not have any reuptake inhibition effect. Which antidepressant is most sedating? Bupropion, duloxetine, doxepin, venlafaxine. You know doxepin. It is the most sedating in the list due to its histamine blocking effect. Now, which mood stabilizer is completely renally eliminated, which may be beneficial for hepatic impairment patients? Valproic acid, carbamazepine, lithium, risperidone. Option C, lithium. Lithium is the only agent used for bipolar disorder, and it does not require any hepatic metabolism. The dose without issue in hepatic metabolism can be given. If the patient is renally impaired, then the dose should be adjusted. Now, which antidepressant has its two principal mechanisms of action 5-HT2A receptor antagonism and alpha 2 receptor antagonism? Fluoxetine, doxepin, meprotylene, mirtazapine. Option D, mirtazapine. It is the only antidepressant with this combination mechanism of action. and it also contributes to its therapeutic effects. Which mood stabilizer agent is most likely to decrease the thyroid function? Carbamazepine, lithium, valproic acid, chlorpromazine. Lithium. We have to check and monitor thyroid function when lithium is administered in the patient. Lithium is the best known for causing a drug induced hypothyroidism after long term use. And this, though it is possible with other stabilizers too, but lithium has the most reported case. This thyroid function test should be performed at baseline and during the follow up to monitor these effects. Okay, thank you.